Well, just when you think that a discussion of snakes, spiders, scorpions, and ticks couldn't get any wilder, there's more. Thanks for joining the Axiom Medical live stream. This is a follow-up to the Venomous Foes webinar from this last Thursday. My name is Holly Foxworth. I'm a registered nurse, and I am the marketing manager for content here at Axiom. And I'm joined by a returning panel member, and that includes Dr. Scott Cherry, who's our CMO, as well as Dara Wheeler, which is also CMO, but she is the Chief Marketing Officer, whereas Dr. Scott Cherry is our Chief Medical Officer. So before we get started, let's introduce you to the team. Dr. Scott Cherry, you want to go first?
Yes, thanks, Holly. My name is Scott Cherry. I'm Axiom Medical's Chief Medical Officer. I'm board certified in preventive medicine and occupational environmental health, and it's a pleasure to be with you here today.
Fantastic. How about you, Dara?
Thank you, Holly. Great to be here. I'm not going to say I'm super excited about the topic, but I'm excited about the interest we all have in this topic, but looking forward to maybe burning down some houses after
there we go.
This conversation.
Well, that's fantastic. So what we're going to do today is go through some of the questions that we didn't get to in the webinar, but we're also going to be taking your questions, your comments, your stories, whatever it may be that you want to share. You can do that live here. So type those in to the question and answer box. Actually, I think it's just the standard box that's on your screen there, depending on what platform that you're in. But we're going to go through, talk through the snake bites, the identification, the behavior, treatment, as well as the same thing for spider bites, the scorpions, the ticks. I think there's some questions even that are pet related, some that are related to Lyme. But what has my antennas up this week is the 20-year return of malaria. So Dr. Cherry, talk to us about malaria. What is malaria? How is it spread? What are the symptoms that are associated with that?
Sure. And, I think maybe talking about the name is a little bit helpful historically. So you can kind of break it down phonetically, mal-air, so meaning bad air. So people thought they were breathing bad air and getting sick and dying. But fortunately, that isn't the case. But malaria is a infectious disease that is transmitted through mosquitoes. And it's a parasite that causes, there's several different versions of malaria, but just to keep it simple, it really causes a systemic infection that can go to your brain, to your lungs, to your liver. And it's kind of called it gives very recurrent, strong fevers and night sweats, which a lot of other infections do. But the biggest thing I think for Americans is that it's really not found in the US any longer. It's still heavily prevalent in other parts of the world. And it's probably one of the largest leading causes of death in the world. And so here in the US, we actually mostly suffer from chronic disease like heart disease, cerebrovascular accidents, diabetes, things like that, kidney disease, cancer. But worldwide, actually, malaria is probably I believe it's probably still the top 3 killers.
Wow.
Mm-hmm.
So I looked at the stats the other day, and it looked like that there was a few cases that had been identified in Florida. And then we also had one here in Texas. Is that still accurate, Dr. Cherry?
Yes. Yeah, I think there's been 5 total now. And, that was really a surprise to me. And we've had some interesting infectious diseases after COVID that I would not have kind of suspected. But malaria is also one of them. But it's really hard to say what's causing this, what makes a mosquito carrying malaria all of a sudden reappear, or, are these mosquitoes kind of very remote and only Americans come across them occasionally and then become infected. The other thing too is a lot of malaria infections are subclinical, so you actually don't have symptoms. And so maybe that's the cause too. Wow. So yeah, it's not necessarily a great message there, but I doubt there's like a heavy prevalence of asymptomatic malarial infections, like kind of how we talked about back in COVID, where there's a lot of asymptomatic infections. So.
One of the things that also got my attention was the discussion of that, if somebody does present with these symptoms, they may not necessarily always be diagnosed accurately in the beginning. Is that
that's probably the most important. That's probably the most important point, and I'm glad you made it. So essentially, American physicians in general will never consider malaria in their differential diagnosis when you present with, broad symptoms. So say, for instance, you go to Africa, they almost always diagnose you with malaria. When I used to help manage an international Ahmed program, almost every one of our employees when they went to the local clinic, were diagnosed with malaria. And so when I visited them, I asked, hey, what testing are you using? Are you just using the old school microscopy and you can see the parasite? They're like, no, if you have a fever and you're here, you have malaria. So it's by default. So if you're traveling for work and with endemic areas or for vacation and you come home, because it does take a while for you to become symptomatic, you definitely want to talk about your travel history with your healthcare provider. But I think that's probably the strongest or the most important point that you made, Holly, is we're not really thinking here in the US about malaria, except I guess after the last couple of days. But again, it's still very uncommon.
Yeah. And I think I read, if I'm not mistaken, that all of those cases that were diagnosed here in the US, none of those were related to travel, correct?
Right. That's, I think, what's most, if it was travel related, it would almost not even be a news story. That's pretty impressive, and again, there's no like if I'm infected with malaria and I have lunch with you two, there's no risk of you becoming infected. So it's truly from a mosquito bite. And so, this is, pretty strong indication that there probably are some mosquitoes out there that have the malaria parasite still as the reservoir.
Yeah, definitely. Yeah. Well, thank you for that information. That means a lot. And so just to recap here, so if you have some of those symptoms, the high fevers, the muscle cramps, or you feel weak, et cetera, and these are going on for long periods of time, then it may not just be the flu. It could be something else, correct?
Yep.
Okay, good deal. Well, thank you for that information. Well, let's talk snake bites, because that's what we had the most questions about. So I'll come to you first then, Dr. Cherry. And so the first one was asking, it was more about identification and behavior question, but it was, can a dead snake still release venom if their fangs are touched or if it's stomped on?
Yeah, and I really like the engagement of our audience on this. And I think a lot of the questions are kind of towards a medical provider, but I think some are towards probably really just a snake expert. And so for me here, I'm not quite certain if what would be the answer there, but I think if you did still come across a dead snake and received a bite or a puncture by just stepping on them, just really close attention to the wound to see if it develops any severe, reaction would be still very pertinent. So there may be folks out there that really know this, but for my professional experience, I don't have, insight into that, sadly.
Yeah. Okay. And then there was one that was on here. I saw that it came up several times last week, but it was asking about submersing your body in cold water if you've been stung to slow the distribution. Do you have any insight as to whether that's accurate or whether
it sounds, reasonable. It's not part of kind of the protocol for snake bites, at least in the pre-hospital or hospital setting. But again, I think there's lots of remedies that never have reached the formal medical treatments that may work. But it's hard for me to give an opinion on that. Yeah.
Dara, I'll come to you with this one. The question was, if we had a venomous snake incident and contacted Axiom, would you have a list of the closest medical facilities that carry antivenom? What do we say there?
That's a great question. And that's one we get every single year. And we follow our own advice in the webinar. And so, no, we actually do not. And the reason why is, like Dr. Cherry and Holly went over, the best way to get antivenom is to go to the closest emergency room and then let them help coordinate it. So what Axiom will do is help coordinate getting the employee into the closest facility, making sure they get taken care of while at the facility, and then working with the local providers on tracking down any antivenom if it's appropriate for that puncture wound.
100%. Yeah. Let's see, Dr. Terry, there was another one that was in here that I really liked that was asking about if you're in a remote area and you don't have access to a hospital, you don't have access to licensed medical professionals, et cetera, in that immediate time period. So the question was, what about treatment when you're in a place that you can't call 911 or go to the ER? So they were talking about if you're in the woods, if you're in the desert, and you don't have cell coverage and you're away from your vehicle, what would you tell them to do if they were bit by a snake and were in that type of scenario?
Yeah, so kind of like how we have pandemic preparedness, I think for austere remote scenarios, work scenarios where really you're essentially on your own for over a day or longer, having a planning with regard to if snake bites are a reasonable risk to go over with a professional about what to look for, and if venomous snakes are an issue, then if it's high enough to maybe even potentially have antivenom there. I think it's really kind of a probability and planning discussion that is would take some time, but it just depends how remote. Like I've supported operations on islands where a helicopter may need to be there like within a day or so. So we have kind of plans that are quite extreme for like rabies or heart attacks. People may be accompanied by a senior paramedic that can give certain and it depends too on the I guess everything about how big the work operation is and things like that. But it really depends on the risks involved. So I would really do kind of a global risk survey of what may happen in these remote work sites.
Okay. Mm-hmm. All right. Well, let's talk about spider and scorpion bites. And Dara, we even had some questions that said, what about Dara's scorpion bite that she had previously? Yeah, that was such a good story. Okay, the first one was, I received a spider bite 9 days ago, and I have a red ring with purple around that area, and it looks like it's spread. Said the doctor had put them on antibiotics, but they were asking, was there anything else that they could do? I know this kind of steps in on some of the personal physician things, but maybe could you speak to a broader level, Dr. Cherry, about some specific measures?
What I think about first is your doc may have given you like some expectations about how this will what will be the natural course of the bite. So if things are getting worse, I would definitely follow up with them quickly just to make sure the antibiotic is covering if there's an infection starting and things like that. But I don't necessarily like to give personal advice on a case by case scenario. But I would just say if things aren't getting better, or if you even just to follow up, just to check in, since you may have further questions, things like that. Okay.
All right. The next one was, if you mischaracterize a spider as being a black widow, but it wasn't, is there a danger in being given treatment as if it were a black widow?
Yeah, that's a great question. So black widows will have a antivenom available. Brown recluses in the U.S. Do not. There is a South American South American recluse that is quite severe and actually has an antivenom too. So there's no such thing as a 100% safe treatment. So, your healthcare provider is going to weigh the benefits and risks. And so antivenom can be, it can be a serious thing to undertake because you can have some strong immune responses. You may not be able to take antivenoms in the future. And so you want to be as accurate as possible when giving a treatment. But I think the spirit of this question is like, is this like a fatal flaw? And it in general, no. So there is concerns about some people being very sensitized to antivenom, things like that. So it is definitely something. It's a real medical treatment that needs medical supervision and potential risks for allergic reactions, things like that. But it's not like a fatal flaw absent an allergic reaction otherwise.
Okay.
Yeah. And Dr. Cherry, I do know that when I was talking about my story and then people asked if I had found that scorpion earlier, would they have given me the antivenom? And I think you're exactly right. My doctor was very reluctant.
Yeah.
Even if he had identified that it was a scorpion, just because he felt like if I could manage the symptoms, that it was probably better for me to manage the symptoms than to get the antivenom injected.
Yep. That takes, that really takes, that's really the art of the practice of medicine is it sounded like, if I'm remembering your story correctly, and I've heard it a couple of times now over the years, but you did have some neurologic symptoms, right?
Yeah.
So like, if you didn't have neurologic symptoms, that's usually easy to say, hold off. As you start to get neurologic symptoms, then that's when you start thinking about like the age of the patient, comorbidities, things like that. You being young, not having respiratory symptoms, you will say, well, we have time to watch things still. If someone's more sick or more frail, then, but then the treatment can still be fairly tough on the person as well. So.
Yeah, I exactly. I think even though the neurologic symptoms and the toxic response was making me think I couldn't breathe or couldn't swallow, I actually, my heart rate and my oxygen levels continued to be fine. So I think as long as he continued to monitor my oxygen levels and felt like I was handling it okay, even though I felt horrible, then he was going to hold off on any additional treatment, which, wasn't fun, but probably I don't know that the antivenom would have been a cure-all at that point.
Right.
Do they ever give anything, Dr. Cherry, for anxiety in situations like that? Because you would think that would give you a lot of anxiety.
They do in the ER. But I think, having a healthcare provider, and I think we find that a lot in our own ICM, is getting good advice and just some reassurance if it's truly, I don't want to say it's a placebo effect, but if you're overreacting to the situation, then reassurance is really powerful and kind of calming things down. If someone is truly short of breath, then it probably is something more physiologic than psychologic,
Yeah, exactly. I think in hindsight, if I had known that I would survive and be okay, I probably would have been a lot more calm. But the feeling, it feels awful. So it was like a few days into it when I knew I could kind of manage it, that it's less psychologically damaging because it's like, okay, you're going to survive, you're going to be okay. But it was just trying to manage all the symptoms to that point.
Yeah. And for those of you who may not have been on the webinar and are wondering about Dara's story, one of the unique components of that is that she was traveling. Weren't you in Mexico, Dara, whenever all of this happened in your stuff?
A very small town with a single urgent care, basically a 2-bed urgent care. But my physician, and I think I mentioned him on the webinar, his name was Dr. Colorado. I will never forget him. He was wonderful and provided a house visit the next day, just to make sure I was doing okay before I flew back to the United States.
Wow.
Well done by Dr. Colorado. We appreciate a home visit all the time. That is awesome. Well, my next question, then we'll stay on the topic and we'll wrap it up with this one, was how soon should I get treatment if bitten by a venomous spider or a scorpion?
Yeah, I think you want to get treatment as soon as possible. That's really the earlier, the better. You can, if it's a true venomous exposure, the sooner the treatment, the better.
Okay.
Yeah.
Okay. Oh, one last question that I thought was another good one. I'll spring this one in. They were asking, would there be an advantage to bringing the spider in? We've talked about you don't want to bring in live animals to the ER by any means, but this one was, would there be an advantage to bring in a dead spider in that was just brown, unsure of what type of spider that is?
Yeah, I think if it's it's easy to do, like with a spider versus a snake, it definitely doesn't hurt, because some providers may be really, really experienced in identifying, and it does give you insight. So there's a huge variable or individual response to these bites. So but it definitely would, the more information the better, the more objective information the better.
Of course. Yeah, pictures are great too if you don't want to take
Yeah.
the actual spider in. Yeah, that'd be great. I'm sure the ER nurses would appreciate a picture where it's just a spider too. Yeah. All right, let's talk tick bites. Let's see. There was one that says, is a tick bite easy to identify compared to a mosquito bite or from other insects? That got my attention, especially since we're talking about malaria. So what would be the difference maker there, Dr. Cherry?
Well, tick bites, the actual bite or puncture spot probably is fairly similar to a mosquito bite, but tick bites a lot of times will have a large redness circle around it, which I guess mosquito bites can get red if you really scratch them. But I think one of the interesting things is we usually will feel the mosquito bite, but you almost never feel the tick bite. So that's probably a nice differentiation. And then a lot of times the tick is, there, but if it falls off, but I think the large redness component may be a differentiator. And then if you didn't really, I guess mosquitoes sneak up on us too all the time, but I think they sneak up on us, but once they bite us, we feel it maybe too late. But I think that's probably, they both have like a puncture mark. That the tick will have a bigger puncture mark. So, everyone sees, well, the way I see it, which, you'll see a bump, but if you look really hard, you'll see like the actual puncture mark, probably better with a tick bite.
With a tick than from a mosquito. Okay. And then there's some questions about prophylaxis for Lyme that was related to ticks. They were asking, have there been any luck on getting preventive antibiotics? Is they've been bitten multiple times, and that Lyme disease was really established in the area where they are located?
Yeah. So there's criteria to give the antibiotic, but if, we're talking usually like doxycycline here, which is a very common antibiotic. And we can kind of contrast the story we just talked about with the antivenom, which is a much rarer administration, right? So people are taking doxycycline for a lot of reasons, but there is criteria for a tick bite to get prophylaxis. So one of the main components is that the tick needs to be affixed to the body for greater than 36 hours. And so it can either be the time that you actually knew the tick was on that whole time, if you left it on for the whole 36 hours, or if the tick is fully engorged, then you can assume that, because the tick is biting you when it's like very small and almost like, I think people say like a speck of dirt even. So, but then once it's been attached for a while, it's going to get bigger and bigger as it does the blood meal. So that's one component. The other component is to give the prophylaxis before 3 days have passed.
Okay.
And then there's some things about pregnancy and just contraindications to doxycycline. But, I think if you don't meet those first two criteria, then you may not, there's the value of getting it is not there. But if you're in an endemic area that Lyme is well established, like Lyme is definitely a very complicated and not a straightforward disease to diagnose and treat. And the symptoms are very difficult too. So it's definitely something that you would, you don't want a tick bite, and then you want prophylaxis if you meet the criteria for sure.
Gotcha. Okay. And then talk to us about circling that and tracking some of the swelling that would maybe be related to any of those bites. Do you recommend making a circle on the skin where that is and just kind of watching the progress? And what would be the reason for doing so?
In many ways, I think that almost maybe applies to the like a snake bite or even like cellulitis, to see if from the snake bite, lots of swelling. With a tick bite, you're probably not going to get a lot of swelling, but you'll get redness. But yeah, you can see if things are progressing or not. If you're not paying attention to detail, just consciously. But it doesn't hurt to necessarily have to see if the cellulitis or the redness or inflammation in the skin is progressing pretty quickly or not. But it's I think it's probably like a very dichotomous outcome. It's either very minimal or it's expanding, And there's this classic picture. It's called like a bullseye target. Like if you think about a cartoon or with a bow and arrow where you're shooting an arrow to a target where you have the bullseye and then you have a clear ring and then another ring. So it's called erythema migrans, to where about a month after a tick bite, it's kind of a classic, tick bite picture, but it's a month late essentially. Yeah.
Okay. All right, let's talk dogs for a second, and then we'll wrap up for the day. There were some questions here. How can we know if our pet has been bitten, and what is the immediate treatment for them?
Yeah, I believe there's like a rattlesnake vaccine for dogs. So if you're in an area that, there's high likelihood that that's happening, I think that is something to consider. I'm a huge dog person, so I think through it that way. I probably don't know anything formally about dogs professionally, but again, if they're outside or on a walk or a hike, and then they are acting excited or disturbed, and then if you see puncture marks and swelling, and they're acting different, like you should definitely seek veterinary treatment.
I think we had somebody follow up, Holly, right, and confirm with us on our chat that one of their dogs or their sister's dog or somebody had just gotten the vaccine for the rattlesnake bite, and suggested still making sure that they get in immediately for medical care. It just helps slow down, I think, symptoms or helps prevent death, but you still want to make sure they get treated. And then in general, I think everybody knows this, but there is some really great preventatives out there for tick, mosquito, and flea bites. And I think people forget about mosquito and a lot of the heartworm and other issues. There's a lot of mosquito-borne issues that dogs can face.
Yeah. Well, I think that wraps up the questions that I had here. Either one of you come across anything else that you want to add?
No, I think this was kind of the double down on what we did last week. And so I was really excited to see all of the engagement on this topic.
Yeah, definitely. Well, thank you both so much. We appreciate it. We hope that you guys have a fantastic July 4th holiday weekend. If we don't see you before, we will be back in July for our discussion of migraine disease. And so if you have not already registered for that, then here, I think Jason has up the graphic, and it will be July 13th at 1:00 p.m. So we hope to see you there. Thank you and have a safe holiday weekend. Bye-bye.